Hello everyone, I'm Medina, Patient Care Coordinator at Cheng Plastic Surgery. Today we're going over postoperative care for subbrow or direct brow or also lateral brow to help often with hooding of the eyes. You're either in the process of your journey now and just want a little bit of insight on how to care for that, or you're considering it and just want to prep for it. So a lot of times patients are worried about the brow in that they don't want that surprise look, right? So they're worried that that brow is going to like crank up there. That is not the goal of a brow surgery. So the brow surgery is really to help with lateral hooding that you may be experiencing, and in some cases adding symmetry to one brow being higher than the other. So if we're going to do a lateral brow, the incision actually will come into the hairline, and that's going to help pull. And then that you're just using baby shampoo and antibiotic ointment to put inside the hairline there. As far as the cleaning goes, so we will give you a specific list of supplies of things that you're going to need on hand: your hydrogen peroxide, your bacitracin ointments, and your eye ointments, along with your drops as well, and then your bruising creams and ice pillows, things like that. For the cleaning of it, in a direct brow, your incision is actually going to be along the brow line upper here. And if it's a subbrow, it's going to be just below in the hairline. You may experience a little bit of hair loss. That's very normal, but we've not had any long-term patients complain about hair not growing back in those areas. And at 10 days, you can technically wear makeup to help camouflage and draw that in. So hydrogen peroxide is going to go onto the Q-tip. You're going to dip that, and then you're going to just follow along the brow line here. Again, either direct is above and then subbrow below. You will see the sutures, and those will come out typically anywhere from 4 to 6 days after surgery. We'll let you know specifically when doctor wants those out. And then I would take a dry Q-tip and then mop up the hydrogen peroxide. So that way, when you go to put your bacitracin ointment on, you're applying it onto a clean and dry incision. And then after that, that is all you need to do as far as the cleaning goes. You're going to do that 4 times a day. So think breakfast, lunch, dinner, bedtime. In between, you're going to be applying your bruising cream. Even though you may not have done anything to the lower eyelids, you are going to get swelling and bruising down the face. That's just the way that the body heals. And in your case, always plan on bruising and swelling, but be pleasantly surprised if you have less. So from that, you're going to apply your ointments wherever you see the start of bruising, and then you're going to ice as much as you can, throughout the day. 10 minutes on, off. As you're resting, just leave that gel pad, forehead on, and let it work its way down. Sleeping with your head elevated, wedge pillows work really well. Think head above your heart. That's really important to keep that swelling and bruising to a minimum. And then typically a day or two after we've taken out sutures, we're going to want you to keep that incision nice and clean. And then at about 10 days, you can wear makeup and pencil in to help camouflage things. Most common things that you're going to experience again with a brow surgery is swelling and bruising. The incision itself will continue to heal. We will give you specific creams to start using at about 2 weeks that are really going to minimize that scarring. Think of it more like a sunscreen, and of course making sure that it is protected from the sun is really important. So hats, sunglasses, things like that. Keeping your eyes, even though it's a brow, we will also recommend that you're using ointments inside of the eyes, because there can be a little bit of tension on the actual eyelid itself. So when you go to close, it may not fully close, and that's why it's really important, especially that first couple days, to keep gel pads on or P's on, so that way you can minimize that swelling, so that the eyes stay lubricated, and also will just help with that swelling. But hopefully these videos provide you a little more insight on how to clean, and yeah, follow along.